Hello preppers, welcome to our blood pressure video. Alright, first things first, let's look at our disclaimer. Although I used to be a licensed physician, I am no longer one anymore. So therefore make sure you check with your doctor about doing any of these things. And anything discussed in this video is simply just for instruction and would never want to do any of this stuff without a doctor or some type of physician present. Now real quick, I'm often asked, why can't I practice? And I mentioned in videos, but not everybody's seen all the videos. I was injured in the Gulf War, I got a head injury. And I can't remember anything. And I didn't lose my license. I gave it up because it got to a point where some days I had great days, some days I couldn't remember what was going on, got confused with the patients, which was not good for them. And even now, when I try to teach or show how these things work, I have days where I can't remember anything, and some days they're going pretty well. So we'll see if we can fudge through it today. And that's why sometimes in the videos you'll see me say things incorrectly because my brain's messed up a little bit. All right, anyway. So with that in mind, I think I still have a couple of valuable things I can put out, and that includes blood pressure. And this video is not going to be all-encompassing about everything about blood pressure. There's no way you could do a video about that because there's so much information. That's why a cardiologist gets paid the big bucks, and that's why they spend years post-doctorate simply just studying more about the cardiovascular system and the heart and everything going along with it. All right, blood pressure is actually in itself pretty easy to understand, and I'm going to kind of show you with this diagram here. Okay, I used to teach college after I practiced, and I really enjoyed this. This is a diagram I made. I know, really simple. But you'll notice the heart in the center is actually made up of 4 chambers. You'll see, and obviously you're not going to be tested on any of this. This is just to give you a bit of understanding. I want you to see from this diagram that your heart, even though it's actually made up of 4 chambers, you have 2 chambers on the right, those are the white boxes you see, and 2 chambers on the left. And your heart really could be looked at as being 2 separate hearts. Right-sided heart, left-sided heart. However, they work together simultaneously. It's more efficient that way. You'll notice the right side of the heart, you'll have blood come into the little square at the top, push to the bottom, then it pushes blood to your lungs. Why? Your lungs give oxygen to the blood. Then from there, notice it says it goes to the top of the left side. So now the blood comes to the top of the left side, is pushed down to the bottom of the chamber, and then from there it's pushed out to, well, the rest of your body. Why? To deliver that oxygen. So basically it goes back and forth through a figure 8, getting oxygen in the lungs, delivering oxygen to the body, back to the lungs, then back to the body. And it does this all day long. Now, when you look at the different chambers, you notice the left chamber on the bottom delivers it to the body. That's got to be a really muscular chamber, and indeed it is. It's exceedingly strong because when it squeezes, it has to push blood to your entire body to deliver oxygen to it. So when you actually have problems, that's often one of the chambers you actually have a problem with. But since it's so strong, it's squeezing it. That's actually one of the main components of your blood pressure. And you often have it, so here's a nice little automatic sphygmomanometer or blood pressure gauge. And you'll notice that they always say the normal blood pressure is 120/80. Now, don't worry about the units. The 120 means millimeters of mercury. It's the old school measurement as far as pressure goes. Just know it's 120. And the 120 is the maximum the heart is putting out for that specific person. Obviously, if you have normal blood pressure of 120/80, that 120 is the most pressure your heart's putting out. So as that left chamber squeezes, whoosh, the maximum pressure it's putting out is 120. That's actually what you're measuring going into this main blood vessel. Now, as the left chamber squeezes down here, it pushes blood to the body, but it does that through a huge artery called the aorta. Okay, now the aorta is so strong and so muscular, you could cut somebody open and pick their entire body up just by that one artery. It is so massive and so strong. So as that chamber squeezes whoosh, and pushes blood to the body, it actually pushes the blood into that aorta. Now your heart needs to take a break because it can't simply just pump all the time because it would wear out. So it literally will pump, then relax, then pump and relax. And so you don't actually have blood pumping and then relax, you have a stroke, where your blood disappears. We actually have to have a way to keep the blood going while the heart relaxes for like a half a second. It's a little bit less than a half a second. And it does that through the aorta. So watch this. As this chamber squeezes and pushes the blood to the body, watch, it squeezes, the aorta will inflate like a balloon. Then when the heart says, I'm relaxed, then the aorta will squeeze and continue that blood pressure through the body. And it'll push it until finally the heart can take over again. So watch, your blood pressure when it squeezes goes up to 120, then when it relaxes, it goes down 110, 100, aorta squeezing. I can't hold out much longer, 90, 80. And once it hits that low number of relaxation, then boom, it squeezes back to 120 over 80 again. So 120, then it goes down to 80. Then 120, down to 80. 120, then down to 80. And that's basically your blood pressure. So the 120 is the max amount of pressure your heart's putting out. The 80 measures the amount of blood, that's pressure that's still going through, even though your heart is actually in a relaxed mode. Kind of cool. But those numbers are incredibly indicative of all kinds of things. Because obviously, if somebody has hypertension, diagnosed high blood pressure, which is actually seeing somebody multiple times and saying, yeah, your blood pressure has been high every single time I saw you. Normal blood pressure is 120 over 80, but obviously much more than that, 140 or above, your heart is putting out too much work. It's that simple. And if my right arm continuously puts out too much work, what's going to happen to the muscle? It's going to get bigger. If my heart continuously pushes too much work over a long time, the muscle gets bigger. And when the muscle gets bigger, it makes it so there's not as much blood inside that little chamber, and therefore it can't work as efficiently. So eventually it just gives up. And that's when you're looking at congestive heart failure. It finally just dies off, and there's not much you can do except drop your blood pressure. And that's one of the things we see in America, obviously, is hypertension, and we treat it, pharmaceutically speaking, to try to drop it. Now, again, you saw the disclaimer. I'm not trying to give you any type of information at all, but I actually read a book that talked about hypertension and said, oh, actually, there's two things that cause hypertension, according to this doctor. Again, this is not me teaching it, just to let you know what they said, was number one, obesity. I'm not the skinniest chicken in the flock. And when I was a lot heavier, mind you, my blood pressure was quite high. And sure, I knew this. I knew this before I read this book. And as I've been on keto and losing weight, my blood pressure has returned almost back to normal. But the second thing this doctor said, which is very interesting, is lack of calcium. And you have to have calcium for your heart to function, period. And you would think the more calcium you put in, the stronger it would be. But he said that basically, since this modern diet tries to tell people not to have so much calcium because of causing kidney stones, it's actually causing hypertension. And it's a very interesting inference. I can't prove it, I can't deny it, but I do know I'm taking calcium too, and my blood pressure has returned to normal. So, again, I am certainly not telling you to do this. I am not telling you to get off your blood pressure medications. That could be exceedingly dangerous. Make sure you check that with your doctor. But with that, hypertension is too much blood pressure. However, the scope of this video specifically isn't about too much blood pressure. We want to focus on trauma. Because if we're actually talking about when crap hits the fan and something happens to you, you're going to have to see, well, is the person bleeding internally? Has that giant leg injury caused it so they lost too much blood? How do we know if your blood pressure is dropping? How do we know if there's something's happening where your blood loss is leading to heart failure? And that's what I really want to show you. And of course, we do this with the blood pressure cuffs. Of course, the manual blood pressure cuff, which we talked about a little bit in the last video, but I'm going to show it to you now. All it does is it's actually really, really fascinating, but so simple. But basically, when you put this on your arm, and then you start squeezing the bulb, okay, it actually is squeezing your arm to the point where when you get, let's say my blood pressure is 120 over 80. The maximum amount of blood that's coming out of my heart's maximum pressure is 120. So if I squeeze this to 130, that's a higher pressure. So the cuff is actually going to squeeze all of the blood so it can't go through my arm anymore. That's why when you get your blood pressure, you have a weird feeling in your arm, because literally the blood pressure cuff has cut off all the blood supply to your arm. And you could last that way for a few hours, a couple hours, 2 to 4, before we start seeing some cellular damage occur. But you can actually use a blood pressure cuff as a tourniquet. It's not the most efficient one, but it'll work. Basically, just keep making sure the pressure is higher than your heart pressure. And if it is, it's going to stop all blood flow to your arm. So what happens is you squeeze this, stops all blood flow to your arm. So when you start dropping the pressure in there, once the 120s hit, you start hearing it in your stethoscope. You're like, oh, blood is flowing again. So therefore the top number, the systolic, is 120. And then when it drops down, 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 you're actually slightly pressing on the artery. You actually have cavitation as the blood's hitting the edge of the walls. But once you hit 80, it's at relaxed phase. You'll stop hearing in your stethoscope, and your blood pressure is 120 over 80. But this video is really not about learning how to check a blood pressure. I don't think that's efficient in teaching that in a prepping channel. Because either A, take a medical course and really learn how to check the blood pressure, or B, get a blood pressure gauge or cuff, and it'll actually will tell you how to do it. Or actually, it'll do it for you. Now, it's interesting, as I pulled out the blood pressure cuff, which I bought this on Amazon. I'll put a link to it in the description below. There's actually a little pamphlet inside that says how to take your blood pressure manually. So if you pick up this one, it's called Paramed. And remember, Paramed actually had a few different ones, but this one had really good reviews on it. There's actually a little pamphlet in here that tells you how to do it. But again, you will need a stethoscope to make it happen. And this Paramed one didn't include one. So I could put my Littmann in there. This is a pretty expensive Littmann, but I'll just put a cheaper stethoscope on there to make it easier. Okay, so blood loss, that's the thing we're talking about. What's interesting is, and why cardiovascular is so dynamic, so amazing, is if you actually have something happen to you, like trauma to your leg, for example, there are multiple things that come into play. And this is what makes it difficult to try to compensate for your blood pressure. So if your blood's squirting out of your leg, your heart will change the way it beats. It changes the speed of its beat. It changes how deep the beat is. Your blood vessels themselves will change how much they squeeze, in your capillaries. It's incredible. It's simply one of the most amazing things you'll see in the body. Personally, I think the brain's cooler, but the cardiovascular system's incredible. But when we're talking about blood loss, let's go ahead and take a look at this little chart I made for you to understand the different stages we're looking at as far as what you're going to see as the patient loses blood. Stage 1 is not really that big of a deal, and don't worry about the numbers like up to 750 mils. We're not going to know how much blood the patient really loses. But we're talking about, at this point, the blood vessels will start to squeeze slightly. So let me tell you about what's going on there. Your heart and your brain connecting to your heart knows that your vital organs, the organs and your brain, are far more important than your skin. So what happens is, if your blood volume starts dropping, then all of the capillaries all throughout your skin will start constricting. It actually has these little valves. We'll close off the valves and make it so the blood doesn't go to your skin, but instead it's shunted right back to the heart. And that way it keeps your brain, very important, and your organs, very important, alive. And that's why, by the way, if you'll see it in the movies, you'll see somebody who got shot in the Old West, and they're coming down to him, holding him like, "Are you okay? I'm really cold." And they'll say something like that. And they should say to him, "Yes, that's because your capillaries are now squeezing off because you're losing blood, and it means you're probably going to die soon." But obviously they don't say that back in the Old West. They'll say they're there and put a sponge in their mouth, whatever they do. But that's what's happening, is the capillaries will squeeze, making it so you're not getting as much blood to your skin. That's why your skin starts turning cold and keeps that nice, warm, oxygenated blood for your brain and for your organs. Stage 2, 750 mils to 1500 mils. Again, don't worry about the numbers. Now it's really pulling blood from the limbs, and your blood pressure is still relatively normal. So you can actually lose 1.5 liters of blood, and you're not going to see much happening in your blood pressure. There's actually some hemodynamic studies I've read where that shows you'll actually have an increase in blood pressure just momentarily before it goes to the next stage. But again, don't worry about that. It's just something that's interesting to know. Stage 3, 1500 mils to 2000 mils, that's 2 liters. Now the blood pressure is dropping. You're going to stop making urine. The skin is cold, clammy, pale, sometimes even blue. The patient will be confused, flustered. Simply put, you must have blood pressure, an adequate blood pressure to your kidneys to make them work. It's kind of like a coffee press. If the press isn't happening, you're not going to have the water going through the grounds. Okay, think of it that way. But the kidneys will start shutting down, and so the patient will stop making urine if that's the case. But now we actually see 2 things that you can really see. Number 1, you'll start seeing the blood pressure dropping. Now this is interesting because you have to understand some people's blood pressure looks low to begin with. Like my wife is like that. 120/80 is normal. But like if my wife's goes in, they'll say, "Oh, your blood pressure is 100/70. And they'll say, "Is that normal for you?" And she'll say, "Yeah, that's normal for me." Because you don't want to have it so, "Oh, wow, this person just had some trauma. I take the blood pressure. It's already 100/70. That could be normal for them. But what we see is it's lower than what your normal blood pressure is, and it's dropping. Now, again, since you don't have the blood flow to your skin, the skin's going to be pale, cool, and clammy. Your lips can start turning blue. And the patient's brain won't have as much blood and oxygen going to it, so they'll start getting confused, kind of not know what's going on. They'll get flustered or frustrated. That's stage 3. Stage 4, now we're in trouble. 2 liters or more, 2000 mils. The heart is racing really fast, and it's also thready, and the blood pressure continues to drop. Now, we call it a fast, thready pulse. You check someone's pulse, which, by the way, if you ever try to check someone's pulse and you can't feel it, don't feel bad. It really does take a lot of practice to be able to feel someone's pulse. So don't stress about that so much. If you actually have the pulse oximeter, which I showed on there, it actually has a pulse on there for you. It may not be the most accurate of pulse checkers, but it actually does pretty well. What happens is, even though the blood pressure is dropping, the heart's compensating by beating really fast. So you actually have a really fast heart rate in this case. But since there's not a lot of blood going through the heart, it'll actually will not put a lot of pressure through. So therefore, it's actually, we call that thready. It's a very weak pulse. So if you have a hard time finding the pulse in the first place, yep, there it is. In this particular case, you may not feel it at all, but if you do, it's going to be really fast and very, very slightly palpable. You may not be able to feel it. So there's the stages you're looking at. Really comes down to this. Stage 3, stage 4, this is when you start worrying about it. And what do you see? We see two things. Blood pressure dropping. And if you can check the heart rate too, it's going fast, true, but blood pressure is dropping, that's the most important one. And you'll start seeing secondary signs, skin clammy, pale, lips possibly turning blue, and you'll actually see their respiration rate start increasing as well. They're breathing shallowly but fast, and then their brain, they'll be confused. So those are the things you're looking for, dropping blood pressure, and they start getting confused and their skin kind of gets cold and clammy. Those are signs that you can look at without actually having much instrumentation, because again, you can even have an automatic one telling you this. Every time you take a blood pressure, write it down, write down the time, and then decide how often you want to do it. Let's say every minute, that's fine. And then 1 minute later, start it again. 1 minute later, start it again, and write down the times and the blood pressures as you do it. Now the blood pressure, you need to understand this, changes all the time. I could literally sit up. I could start looking at a scary movie. All these things can actually change your blood pressure from moment to moment. So you need to write it down because it's very difficult to understand what's really happening with it unless you actually log it down on a piece of paper. So keep it logged on there and keep doing it. That way over time, you'll start seeing the blood pressure dropping. And there's the key. Then if you start seeing the cold, clammy skin, turning pale, and then also confusion, then you know that they probably have some bleeding somewhere leading to this. But there's more to it than that. All right. There's one thing that people practically never take into account when it comes to blood pressure. Again, it's not on, but I think you understand this. 120 over 80 is the normal blood pressure, right? But when you actually take 120 minus 80, the answer is 40, that's called your pulse pressure. And that actually determines how much pressure is going through the body as well. And if you actually want to see if somebody is bleeding out, the best way to understand that is that if that pulse pressure is less than 25% of the systolic, now you have a problem as far as their blood pressure is dropping too much. So look at this. We have 120 over 80 is normal. But look, this person's blood pressure is 106 over 82. That almost seems normal, doesn't it? Almost. 106 minus 82, that's our pulse pressure, 24. 24 is less than 25% of the 106. So 106 divided by 4 is about 26-ish, around there somewhere. 24 is less than 26. So this person is actually heading into shock. So we can see not only is the blood pressure dropping, but that pulse pressure is dropping. Take the systolic number again. For a normal person, it's 120 over 80. So take 120 divided by 4, so 30, and look at the pulse pressure. For a normal person, it's 120 over 80, so the pulse pressure is 40. That's more than 30, so that's a good patient. But if you actually subtract those two and it's less than 25%, now we actually have the person going into what's called hypovolemic shock. Don't stress on the word. Hypo means below, volemic means volume. They don't have enough blood in their system. So in other words, if you see that pulse pressure dropping less than 25%, blood pressure is dropping, skin cool and clammy and such, they're not getting enough blood in their system. They're bleeding somewhere. And if they're not bleeding outwardly, they're bleeding internally. And I'll tell you, if we're talking about, and that's what we're looking at here is when crap hits the fan, you're going to have to figure out what that is. And if it's inside their abdomen, I'll tell you, the person's going to die. Unless you know how to do some kind of vascular surgery, which you don't, which I don't, then there's not really much that can be done in those situations. Or kind of is there? Let's go ahead and look at some different things that actually take place when it comes to hypovolemic shock. Hypovolemic shock can take place obviously from blood loss, but it can also be from burns, diarrhea, vomiting. That's basically water loss in either direction, up or down, and dehydration too. So the hypovolemic shock doesn't necessarily have to be from blood loss, but the volume can actually be from water loss as well. That's something to take into account because especially if your crap hits the fan out in the woods and you've been drinking creek water all day and now you keep throwing up and having diarrhea, well, now you're looking at some serious problems. You're actually losing your volume that way, and that's actually a killer. It definitely can kill people. Dehydration, if you really have true dehydration, I'm not talking about where you're like, oh, I'm so thirsty, give me something to drink. I'm talking about you're puking, your blood pressure's dropping, diarrhea, squirting stiff. That's really bad news. You are literally heading toward death. You need to find a way to replenish your liquids. So what you can do to treat for the shock is, well, first make sure they're comfy and warm. Maybe have like a little blanket for them. You can also put them in, don't worry about this word, Trendelenburg, which simply means you elevate their feet about 12 inches up. It actually helps, surprisingly. And then reassure them, it's going to be okay. It's going to be okay. We're going to take care of you. I mean, listen, if they do end up dying, at least they're going to die comfy. I know that's horrible, but that's what you have to look at in these situations. We're in crap hits the fan. There's no more doctors, no more hospitals. You're not a vascular surgeon, neither am I. And sometimes there's not much you can do. But that person has lost so much fluids, you need to get the fluids back in them. So how do you do that? How do you get the fluids back in them, especially being out in the wilderness or wherever you're at? Obviously, having a normal saline IV is key. Other drugs we can use, dopamine, epinephrine, norepinephrine. But again, those are all things that you and I will not be doing. I don't have any epi I can give them. I mean, honestly, normal saline, I do have a recipe for making normal saline, but once you actually start breaking that skin and putting it in their bloodstream, unless you have everything sterile and done right, it could cause serious problems. Not to mention, have you ever started an IV before? Have you? It is not easy. And you may actually have a nurse in the ER who is like amazing at it and gets the IV first time. It's because they're veterans. It takes a lot of practice, a lot of patience to get IVs, and you have to know how to do it. That's a whole different video, which honestly, I will not be doing. I'm not going to do a video on showing you how to start IVs. That's not going to happen. But starting at normal saline IV will help. Not going to happen where we're at. Having epinephrine, norepinephrine, dopamine, we don't have any of that stuff. What can you do? Well, you might think, and don't think this by the way, I might think, I'm just going to go ahead and give them water. If you know they're going to die, which you just gave them a death warrant if this happens. In a regular modern society like this, the last thing you want to do is give them water. Because in that situation, they may have to go in for surgery if it is trauma, and it can actually cause aspiration, cause them to basically have the fluid into their lungs and kill them. So you don't want to ever give somebody anything to drink. Now crap hits the fan, there's no doctors, and the person is on their last thing. And the old West Hollywood, here, take some of my water, thank you. Modern medicine, you can't do that. But if they're going to die, it's up to you. Again, disclaimer, I'm not telling you to do these kind of things by any means, but that's something you need to take into account, that is certainly something you don't want to do. There is an option though, and that's actually giving them an enema. An enema obviously is simply just injecting the water up their butt. Start off with 1 liter of water, add a half a teaspoon of salt, 8 teaspoons of sugar, make sure it's nice and warm, not hot, put it into some kind of bag. Plastic bag will work, like a Ziploc bag. Run a rubber tube. So a half a liter of the fluid goes to the tube, insert it about 3 inches up the anus. Put a little bit of water on the tube first, it'll make it go in a little bit easier for them. And then raise the bag to the height of their hips. Now in this case, the patient's gonna be laying on their left side. That's very important because the colon goes down, it's actually going to help keep the water inside their rectum, where guess what? It gets absorbed. That's the purpose of your large intestines, by the way, is to absorb water. Do you know that? Your small intestines absorb food, but it's so slushy, nasty, diarrhea fluidy. When it hits your large intestines, it goes slowly through your large intestines and it absorbs the water. Here's a little concept for you to understand this. If for some reason your large intestine's moving too fast, that's diarrhea. It didn't have time to absorb the water. Or if the large intestines are going really slow, it has a lot of time to absorb that water, and it can be dry feces or constipation. So the large intestines absorbs water. So when you actually have them lay on their left-hand side, you put the tube up the butt, you run the water in, and a half a liter, to make it so it's the flow rate, it'll take about 20 minutes to go in there. If it starts leaking out the butt, you're going a little bit too fast, but have it slowly go into the rectum and sit there, and they'll actually absorb that water into their bloodstream. So there's kind of like a way you can give them an IV. And by the way, giving that sugar and salt concentration mix I talked about is pretty darn close to normal saline. It's not because of the sugar in there, but nevertheless, it's actually really good for them. It's going to help with their body chemistry. And the enema is actually a really quick and easy way you can give somebody fluids back to them without trying to give it into their mouth and without starting an IV. Pretty neat. Okay, so blood pressure, practically speaking, that's the biggest thing that we're going to have to deal with when crap hits the fan. People who have hypertension, that's a different story. But if you're actually going to be losing blood pressure, maybe you have trauma, maybe you put a tourniquet on, but it took you a while to get it and there's blood all over the floor. Maybe the person has diarrhea or vomiting, very good chance that's going to happen. Or if they have dehydration, very good chance that's going to happen. Your best bet is an enema. Best bet is an enema. And it's actually, I mean, look, if their pee stops and their blood pressure drops, you know that's what's happening, and that's the only thing that's really going to help them out quite a bit is the good old enema. So having like some kind of enema kit would be helpful. You don't even have to have it. Having a little rubber hose, as far as maybe a 1/2 inch, as far as the lumen there, and a giant gallon-sized Ziploc bag will work just fine. And you can actually slowly replenish the fluids back in through the rectum. There's a lecture we thought we'd not be given tonight. But anyways, being able to check the blood pressure is important for this. And again, if you have one of these, a manual cuff, you know how to check the blood pressure regularly, practice, that's great. This thing is so accurate, it works very well. However, these ones, as long as you have power and you have batteries, will check the blood pressure for you over and over again. But remember, keep a log on it. You want to constantly monitor the patient, keep them warm and comfy, put their legs up, Trendelenburg, and slowly replenish their fluids. Because that's the only thing that matters more than anything else. Because if not, their heart, if they don't have enough fluid in there, they'll not have enough blood to their brain, not enough blood to their organs, and the heart can't pump it, and they will die. You have to get fluids back in them, especially if they've actually hit over stage 4. Okay, anyway, so there's our first of our real medical videos. I hope this helped for you. Hopefully you'll never experience any of this stuff when crap hits the fan, but at least you have this and you know how it's done. And if you have any questions, put them in the comments, or better yet, the better way to do this, by the way, besides comments, because I try to read through the comments, but there's so much stuff, is go to our Facebook group. I'll put a link, there's a link in the description below, and ask the question there, because I'm not the only doctor in the group, by the way. There's other doctors there too. And to be able to answer these questions, there's a lot of people, we get into these discussions. And if you're not on Facebook, and I understand why you don't want to be on Facebook, I don't like Facebook either, but at least there we can communicate with one another, and it actually helps out quite a bit, because when I get so many emails, it's hard for me to answer all of them because there's so much going on. All right, hope you enjoyed this. And we'll be putting a lot more of these medical videos out. If you have other preppers, I would highly suggest they watch these videos, because it is really good survival medicine to be able to counteract things that you very much likely will see when crap hits the fan. All right, let's continue on with the preps and see this video. And thanks so much for watching.